KSJE Evening News at 5:30.
Hi, I'm Yael Cassander.
And I'm Don Glass.
And we host A Moment of Science.
For more than 20 years, A Moment of Science has been taking an entertaining look at the science behind some of life's most perplexing questions.
In just 2 minutes, you get a look at the fascinating world around us and beyond.
We hope you'll tune in.
For more information about A Moment of Science or to download our latest podcasts, visit us at amomentofscience.org.
Listen weekday afternoons at 5:45 on KSJE. This program is supported by San Juan Health Partners Urology, providing a wide range of personalized services for the whole family, including children. Our caring professionals are dedicated to helping meet your urology health needs with skill, experience, and service you need. For a complete listing of our services and to learn more, visit sanjuanhealthpartners.com or call 505-609-6300. San Juan Health Partners Urology, a division of San Juan Regional Medical Center. Ten minutes past 8 o'clock. It's Wednesday morning, January the 16th. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in to KSJE 90.9 FM, the information and cultural beacon of the Four Corners, broadcasting from San Juan College. Take a visit to the Encouragement Lab. Dr. Mike Hadaba will be joining me, and we'll be talking about the concept of positive gossip. That is Dr. Hadaba's lesson for us this week. We'll hear more about that coming up this morning at 8:55. Then at 9 a.m., Mick Hess will take us roving with the arts and the great composer Britten. Music from him. Coming up, we'll hear the War Requiem today at 9 on Roving with the Arts with Mick Hess. And then don't forget, at 10:30 today, it is our local and regional author program right on Four Corners. And this week's guest author is author Rosemary Zybert, and she is talking to us from her home in Santa Fe. She's written several children's books based around the World War I era. She'll talk about those and many others with Tracy Hales-Vass. That is coming up this morning at 10:30 on KSJE, so we hope you'll join us for that program as well. But as I mentioned, let me get to my guests who are here with us this morning from San Juan Regional Medical Center. We welcome back to the KSJE microphones Dr. Bob Underwood, who is here, the Chief Medical Officer. Good morning.
Good morning. How are you, Scott?
I'm well. Welcome back.
Thanks.
Good to have you with us. Also joining us here in the studio is Marcia Montoya, and she is with Clinical Informatics at San Juan Regional Medical Center. Good morning to you.
Good morning.
Thank you for being here.
You're welcome.
And what brings you both to the studio this morning is to talk about this new Care Connect program at San Juan Regional Medical Center, which will be starting midnight Saturday, I guess, right, Dr. Underwood?
That's correct. It's actually Friday night into Saturday morning, about 1 minute after midnight Saturday morning.
Okay.
The system will go live.
Okay. And this is the next step, basically, as I mentioned, in these digital medical records technology, right?
That's correct. It is a long time in coming to San Juan Regional Medical Center, but it is an upgrade to, we have computer systems right now, but we have a whole bunch of them. This will be one system doing the work of what all of them are doing, so it'll increase the coordination, it'll improve the information flow, the information accessibility for the providers, nurses, respiratory therapists, everybody who works at the hospital.
And this is an important, I guess, step forward in this whole transition into online digital medical records.
It's absolutely an important and I would dare to say even potentially overdue transition at our organization. It's really bringing us into the modern era of information transfer for patients. And
a lot of folks who are watching and listening to us this morning may be wondering why the big push for online medical records. As you mentioned, we've had medical records online and
yes,
digitized for generations already.
Yes.
This just helps with instantaneous sharing of information and a lot of other pluses, right?
Right. So there are quite a number of things. Some of it streams around patient safety, making sure that the information is available to the clinicians that are caring for the patient. But it also revolves around efficiency. If you listen to anything around the national healthcare issues and the cost that's involved, most of that cost is around inefficiencies of care, coordination of care of the patient. And so the electronic medical record helps with the safety components primarily for our patients, but it also will develop efficiencies of care especially as patients transfer from one mode of care to another, inpatient to back to their primary care provider, or from an outpatient setting into the hospital. All of those transitions will become more seamless.
I see. Interesting. And Marcia Montoya, let me turn to you a little bit and ask you about your part in all this, because working at San Juan Regional Medical Center, you are coordinating with all the different departments and areas of the hospital with this changeover?
Correct. So my role is working between the clinical world and the information technology world. So working with dietary, physical therapy, speech therapy, inpatient nursing, critical care nursing, and all those groups to make sure that it all works together. That,
right.
that what they do, everyone else can see, and that really it all works together for the good of the patient.
And as all of these departments are adding data, adding information to these records, then it's possible then that other areas of the hospital can be reading that and interpreting that to see what's going on with that patient's health, or the computer could be looking for patterns?
Absolutely. So if I, the inpatient nurse, enters something, the nutrition screener is going to be able to see that as soon as I sign it and they log in, they will be able to see that information. So they'll no longer be having to mine that data from the patient's record. It will automatically flow into their documentation. And then it will also be looking for trends. We've got some alerts set up, different things that will actually look for trends in the background of things going on with patients, and then it will notify, send an alert for the nurse to be able to see. To
whomever, I suppose,
and
right?
the physician, yes.
Yeah. And Dr. Underwood, this means that then the computer is not in charge of the patient's health. It still goes back to a human nurse
Correct.
or physician or somebody to look at what the computer is alerting them to.
Sure. What we call these are clinical decision support tools. So it helps with the making of the decision, but the decision is still up to that clinical expert, be that a nurse, respiratory therapist, physician, who's involved with the care of that patient. But it does alert them that, hey, there's a pattern here that you might want to pay attention to that perhaps wasn't as obvious as you looked at the patient previously. The computer can pick up the subtleties, changes in vital signs that could be trending a particular way that may not even be out of the ordinary yet or outside of what we would call normal parameters, but the trend is what the computer is starting to pick up on. Other clinical decision support tools are allergy interactions that we had mentioned. If a patient has a listed allergy and medication is put in, even if there's a cross reaction with that allergy, the computer will recognize that and alert someone that this is something that the patient could potentially be allergic to. But then it still goes back to the clinician to look at what's the risk-benefit of providing that medication or not, or choosing an alternative. Drug-drug interactions is another one.
Right, sure.
If there are two medications that may have an impact on one another, there are some antibiotics that can prolong the span of your heartbeat, and that can affect other medications. And so the computer knows that and will spit out a alert to the clinician doing the ordering, saying, hey, this may not be something that you want to do. Perhaps another drug choice would be an option.
I see. And this brings together or eliminates, I guess, a lot of other ancillary apps and programs that the hospital had been using, I guess. So this is kind of a more one umbrella kind of a program.
It clearly is. So in our San Juan Health Partner offices, we use one particular kind of program. In the emergency department, we use a completely different clinical application. In the inpatient areas, we use another one. And so now when a patient is being seen in a San Juan Health Partners clinic, that information is going into their medical record. And if that patient has to come to the emergency department, then the emergency physician will have that record, not have to have it sent over or anything else. It's right there for them. And the same thing will happen when if and when that patient needs to be admitted through the emergency department, that record continues to carry over into the inpatient setting. That's something that we don't have the luxury of right now. That's especially important. Can we get that information? Yes, we can, but it takes time. I'm an emergency physician by training, and sometimes time is not a luxury that we have in the emergency department. So to have that information immediately at your fingertips for the care of the patient is profoundly impactful to the care.
But we always hear how important time is when you're dealing with medical care, whether it's
Absolutely.
a stroke or a heart attack or something else, right?
Absolutely.
To get information so that a decision can be made about the course of care.
Correct, and make it in a timely way so that it benefits the patient. And again, that helps us coordinate that care in a timely way across all spectrums of the care.
Right.
Yeah.
Marcia Montoya, with the people that you were working with, again, to get this information in almost instantaneously, I would assume, right? If it's a computer
Correct.
type of networked program, right? It's going to everybody at the touch of a button.
Correct. As soon as they sign their documentation, then others can see it in that patient's record. And so if I'm getting a patient transferred out of ICU, I will be able to see what's gone on with them in ICU very readily and trend vital signs and trend that information without having to go into another system or look through a scanned document.
I see. My guest this morning from San Juan Regional Medical Center here in Farmington. We were talking about their new Care Connect program. We are getting a lot of messages from folks who are watching us this morning on Facebook, everybody. So hello to our viewers who are watching in Farmington so far, and Aztec I have seen, and some others. Good to have you along with us. And with this, Dr. Underwood, this is something then that can communicate with other medical doctor's offices in the community and other hospitals if the patient's being transferred and things like that. Does that help with that communication as well?
It does help with that communication. It depends on what platform that they're on in terms of our ability to share that information. But if they're on a Cerner platform, there's a methodology to share it without what we call breakdown privacy barriers, et cetera. But all of the physicians in our community who are associated or on staff at our hospital, even if they do not use this medical record in their office, they will be able to go online and access the chart of anything that happened for a patient while they were within our system. So if a patient, for example, is seen in our office or one of our offices and they're referred perhaps for an evaluation for hip surgery, then the orthopedists in our community who are not part of San Juan Health Partners will still have access to be able to look at the records for this patient and see what care has been provided.
I see. And others, if they're being transferred in or out, that works as well? Other hospitals?
It depends on the chart and whether or not they can access our information via our chart itself. So some systems are on an Epic platform and they may not have immediate access to our system, but we will have access to a patient portal, and then the patient themselves can actually access a bunch of information. One of my experiences as an emergency physician, this was years ago, was somebody who was from out of state and they came in seeking care. They had somewhat of a complex history, and we had computers in every room, and they said, will that get on the internet? I said, sure it will. And so they actually logged into their own chart from another state so that I could access their information to take care of them in our emergency department.
Interesting. That brings up another question about folks who are traveling that do have a medical problem, right? And then this
Correct.
would be able, they could call San Juan Regional, I guess, and get their medical records
Yes.
transferred or accessed?
They could be accessed, or the patient can access them themselves.
Right.
Those are all capabilities that the system would have. It's all recorded, and because it's not on paper, it used to be back in the days of old, where you would call the medical records department at the hospital, they would find the paper file, and then they would have to fax all the pages that they thought may or may not be pertinent to the care. All that's gone now.
Wow. I mean, and hoping the fax goes to the right person and you don't violate HIPAA and everything else. Right?
Absolutely, and unfortunately, there's lots of stories of that happening.
Sure, but
Yeah.
this is much more secure, obviously.
Completely secure, yeah.
And that's part of this, is what we're talking about.
Right.
We are talking about the new Care Connect program at San Juan Regional Medical Center, which will go into effect at apparently 12:01 a.m. Saturday morning.
That's correct.
As they switch over and switch to this new system. And so I guess for patients, though, they really won't notice a big change. I mean, they're still going to be dealing with nurses and doctors and the regular staff, right?
Right. Yes, that's absolutely correct. It should be relatively transparent to the patient who's getting care. Unless they're trying to access their own information through the patient portal, that'll look a little bit different.
Right.
We've always been entering information into a computer, and so you will still see nurses, physicians accessing data systems. It's just a unified system. Yeah, and that's the other component of this. The training behind this has been going on literally for months to get physicians, nurses, everybody ready for this transition. We've had hours and hours of classroom training, online training, to learn how to use this system, how to efficiently maneuver your care flow through the system. It's been quite an undertaking.
I would think so. And Marcia Montoya, is that where you come in a little bit with some of this training, but working with the other departments too to make sure they're all up to speed?
That is where some of mine has come in with training and just with working with them. You know, we've went to every department and looked at what their current workflow is, what their future workflow will be. So it's not only just learning a system, it's also learning, here's how I do things today. Due to the capabilities of the system, we're able to improve a lot of those workflows and a lot of those processes. So it's not only been learning the computer system, it's learning new workflows and new processes as well.
Right, and with these other folks that are putting all this into the system, again, as a patient maybe is transferred from maybe a inpatient hospital room, staying at the hospital, to outpatient to see how they're doing and to follow up. This is all part of this transition, right?
It is. And I think one of the benefits that I think patients will see is not being asked some of the same questions at every level of care. You're in the physician's office, they ask you for your medication list and update it. You come to the emergency room, because it's a different system, that same information is requested. You go upstairs to your inpatient unit, it's again another system. And so really, staff will just be reviewing that information with you, not recreating the list every time. And so I think the community and patients will see that benefit of some of those same questions not being asked again and again at every point of care.
Right, right.
It'll be more of a review of the information.
It's already there.
Correct.
On the screen, hopefully.
Correct.
In front of the whoever's asking the question, or
Correct.
used to ask that question. They won't be asking it anymore, is the idea. Dr. Underwood, again, with this continuum of care that we hear talked about, this is what you're talking about, is this type of, whether I'm going to my physician's office and then I have to go get a test somewhere and I have to come back and get x-rays or blood test or whatever, this information follows me wherever I go.
Correct. And so the duplicative nature of some testing should be potentially eliminated. If sometimes, say, one physician doesn't know an order that another physician has put in and can't readily see the results of that, so it gets reordered. And sometimes patients aren't even aware that the blood tests are actually being duplicated. So this will eliminate that possibility. The physician will just be able to go into the system and say, oh, I see you've already had that. I do want to add this, but we don't need to repeat that other test. That level of coordination will be there. Easily accessible to. That's the other thing, is the system that we currently have, especially in the inpatient unit, is an older system. It's not really easy to find information in. This one is a much more intuitive layout on the screen, and where do I go to find this piece of information, or this lab study, this x-ray result, etc. I can find it really, really fast.
Interesting. So, it sounds like what you're saying, Dr. Underwood, is this might save money.
It will.
Either for me or my insurance company, or both.
Both. Especially in the days of high deductible plans, as most employers have gone to these days, yes, this will save money.
Okay.
And if you look at it on a national basis, we've got a $2.8 trillion healthcare budget in the United States. It's huge. And so we're always on a national scale looking for how do we make this more efficient. We're world class in terms of the care that we deliver in the United States. However, the delivery methodology is not the best, and that comes down to the coordination piece. This is really going to help us with that.
All right. On that note, we'll take a short break,
Sure.
everybody, in our conversation, but we'll talk about this and much more when we come back in just a moment. Again, my guest from San Juan Regional Medical Center. We are talking about the new Care Connect program, all about information technology transformation at the hospital with medical records. Back with my guests with more in just a moment right here on KSJE. This program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-599-01